Oh, this is wonderful. The 2008 Premier's Award for Outstanding Cancer Researcher is Professor Simon Chapman.
I did my PhD at the University of Sydney, and then I did my postdoc work in the UK, and I've spent a period at IARC, the International Agency for Research in Cancer in Lyon. I came into public health from an education background. I'm a sociologist, and found the challenges of trying to address a problem as big as tobacco smoking, where when I started, something like 45% of men, about 35% of women were smoking on a daily basis, to be really, really challenging. We've now got that down to 20% of people smoking, with as low as 13.9% of people smoking every day in New South Wales. My research is essentially trying to provide strategic information which is going to be useful to policymakers, regulators, lawmakers, people who are running campaigns which are going to influence hundreds of thousands or millions of people. And so it's what's known as strategic policy research for tobacco control. Fortunately, we've been very, very successful in Australia in using research to motivate governments to take action against tobacco. Tobacco control in Australia has been a template for countries all around the world. The research effort, which has been the bedrock of that, has been terribly important, and looking back over my career, I feel very, very pleased that I've been able to be a part of a movement which, at the end of the day, in the last 10 years has reduced lung cancer incidence by 19% in this state. And smoking levels have never been lower, particularly in children. I think the most important thing I can do at this stage in my career is translate the lessons that we've learned in wealthy countries with good research funding into our neighbouring countries, and I've been very fortunate to have just acquired with other colleagues a $3 million grant to work in China on tobacco control. There can be no greater challenge in tobacco control than that which faces us in China, with 350 million people smoking every day. It's very satisfying coming to work every day and knowing that my work is contributing to a reduction in the leading cause of cancer death in this country. When I go home at night, I sometimes have to pinch myself to think that I'm actually paid to do this wonderful work.
This is a very, very humbling experience indeed. My heart is racing away up here, I can tell you. I'm not normally like this. I do a lot of speaking, but I've got a big lump in my throat. I've got a lot of awards over the years in tobacco control that have been awarded to me by my peers in tobacco control, but this is the first time I've ever been honoured by the cancer control community. So with the spectacular minds which are in this room and the work that you're all doing, you can just imagine how it feels to be up here tonight in front of you like this. I think everyone who works in chronic disease prevention understands very well that it's very, very easy to put off or delay prevention and the research on which it's built. There's simply none of the urgency that you have with acute health care and health problems. People who don't have cancer are not desperate to be helped, if you see what I mean. You take the program RPA, the TV series, which has been just massively successful. Each week we see clinicians doing heroic things with procedures and drugs and diagnostics and machines that scientists have all helped produce. We see grateful patients and their loved ones, tearful and thankful for the research, what research can achieve. Cancer control is absolutely thick with battle metaphors and struggles and fights. Talk about winning the war. So just imagine how it is for those of us working in primary prevention. Imagine us trying to approach a TV station, trying to sell a program idea about the day-to-day drama of prevention. You saw in the film up there me with my research staff looking at computers, looking at a few books, that sort of thing. When the camera came along, they said to me, "Oh, have you got a stethoscope or something, a microscope you can look down?" And I said, "No, look, the best drama I can give you is you could film me for sort of 5 or 6 hours a day looking at my computer screen. Probably the most riveting spectacle would be drawn-out sort of strategy meetings, or a sort of the rare opportunity I get to speak to politicians like Verity Firth." There's not high drama in it, and it stretches out for many, many years for us to be able to achieve the things that we have. The paradox of prevention is that it works when nothing happens, when people don't get sick and die. People never come up to me, or it happened once actually, and pump my hand in the supermarket and say, "I don't smoke, you saved my life," right? And I'm sure that has happened to many of you in the room who are working in clinical medicine and research. As I said on the film, Australia now has the lowest smoking prevalence ever recorded. Daily smoking in New South Wales is down to a remarkable 13.9%. That's daily smoking. The poster child of this is, interesting, British Columbia. British Columbia is what we all try to emulate, but we are breathing down your neck in British Columbia. The decline is showing no signs of a let-up. I think, just as importantly, children's rates are at a record low, and they're also showing no signs of popping back up again. You all know in the room that lung cancer is our biggest killer. Male lung cancer peaked in 1980. And today, I consulted, looking for some slides I was preparing for a lecture, that the rate per 100,000 that we have today hasn't been like that since 1950. So that's the progress that we've seen on lung cancer. Female lung cancer is slowing, and I don't think we'll ever reach the rate that males have attained. So I think that we may be nearing a bit of an end game in smoking in Australia. There's serious discussion amongst my colleagues about whether we can get smoking down to 5%, or maybe even down to about 2%, which is what doctors are doing at the moment in Australia. The research-based policies which have caused this, things like advertising bans, smoke-free workplaces, restaurant bars, ghoulish tobacco pacts, and the highest funded anti-smoking campaigns in the world, have all played out over decades. Prevention takes one very special thing as well, and that is that it takes politicians and health leaders with maturity and vision to rise above the very day-to-day rule of rescue of cancer work. And I think in this state we have been exceptionally lucky to have, first of all, Frank Sarter come along with the vision that he had, and then to appoint Jim Bishop with all the impetus that the Cancer Institute brought to it, and then to have Verity, you step in. I never forget, I don't know how long ago, it was about a year ago, I got this telephone call, come in and talk to Verity. And I've talked to, I don't know, countless health ministers throughout my career. I remember one went to sleep. And when I went to see Verity, she had a pad out, and it was like she was really interested. And I went away and I told all my colleagues, this is going to be good. And it is good. And we've got a new raft of reforms which have just been announced, and things are looking terrific. I think of all the 300 papers that I've published throughout my career, the ones that I'm most proud of have been those which forensically exposed tobacco industry malfeasance over the years. The lying to the public, to the political interference, all of this sort of stuff. The public airing of this sordid track record has really poisoned the industry's well, and I think vastly reduced their influence. I'm fond of saying that the tobacco industry are like cockroaches. They spread disease and they don't like the sunlight, and a lot of my work is to put the sunlight right on them. So thanks very much, everybody.
Simon, can I ask you a couple of quick questions, mate, if that's all right? Congratulations, Professor Chapman. I just want to ask you a quick question, Simon.